just go into a health food store or a grocery store or CVS and they look at the label, oh, take one a day. Okay, perfect. Well, one a day may not be cutting the mustard for you as an individual. It's better than taking nothing, or they may take too much. Maybe they don't need as much of that. It was interesting. I had a patient come to see me. This was an interesting case. Her primary complaint was that she was having a lot of bowel issues, digestive issues, chronic diarrhea all the time for the past 4 to 5 years. The first thing I did was I said, okay, what supplements are you currently taking? She was taking a lot. She's like, I don't take any medications. I take a lot of supplements. So the first thing I looked at was the quality of the products she was taking. And she brought all her bottles, which was fantastic. I looked at the back and I said, this product right here is giving you your chronic diarrhea. She goes, how could that be? I said, this is a magnesium product. This is the poorest form of magnesium. It's called magnesium oxide. I do use it in my practice. You know who I use it with? People that are constipated. I said, you're not constipating. You're taking this every single day and you're getting loose stools. I said, I'm going to cure your diarrhea. You're going to stop taking this product. So she did. She came back after a week and she goes, wow, I'm not having diarrhea anymore. I said, okay, well, what else is going on? So, so that's one case. I've had patients who came in with neuropathies in their hands. And I look at the supplements. I said, well, you're taking massive amounts of B6. I said, why are you doing that? Well, I heard that it's good for, neuropathy. I said, well, the form you're taking, unless, genetically, if you have a hard time metabolizing that, it can build up in your nerves and actually exacerbate your neuropathy, the numbness and tingling in the hands. I said, we're going to switch you off of that. We're going to put you on an activated form of B6 called P5P and see how you do. Lo and behold, numbness and tingling goes away. So, I like that people try to take their health into their own hands, but they need proper guidance. And, they're not going to get that from your conventional doctor. You ask a doctor about a supplement, they go blank. They don't know what to answer unless they're into it. Unless they've been trained formally in vitamins and nutrients and herbs and things like that. Most conventional MDs are not going to have an answer for you. So that's where I come into play. That's where my book comes into play, because it will educate you. So in the book, I go through majority of the nutrients that are essential to check for, and that should be supplemented. And I talk about the reference ranges, and I talk about the specific dosing, the quality of it, because one size does not fit all. You can buy a magnesium product for $2, a bottle of 1,000 pills, at Costco, or you can buy a quality product for $40, and it's a month's supply. Big difference in terms of the quality control. One's like just eating eating rocks. The other one is a good quality that you're going to absolutely absorb. So that's crucial, and that's what I try and educate people on with what we're talking about in the book. Yeah.
Well, I think the other thing is that people try to skimp on health and they think they're saving money.
Absolutely.
It's like you're internalizing these things and trying to make them part of your body, and if they're not the right formulation to be able to bond and internalize, you're either just wasting it or you're having it build up in your body to find out later.
100%. No, that's an awesome point. Yeah, I mean, because I'm seeing, you nailed it. Because that's what we're seeing is that people are, they're either going too hardcore in one direction or they're not doing anything at all because they're overwhelmed by it. I have patients come in all the time and they say, I want to take some supplements, but I walk into the store and I'm like overwhelmed. There's 1,000 bottles here, and I'm not going to just ask the guy that's working there because he's going to try and push everything on the shelf to me. So people tend to say, okay, well, I'm not. Or then you have the opposite, where people come in with a crate, of all their supplements, and they drop it on my desk and say, I'm taking all this. I said, why? And they said, well, I heard this is good for this and this is good for this. And I said, well, this is what we're going to do. We're going to run some lab work. I'm going to listen to you. What are your complaints, your concerns? You may need just, a fraction of these things. I just had a guy the other day, same thing. He actually went to a colleague of mine who didn't run any blood work and just went by sheer clinical signs and symptoms, loaded this guy up with tons of supplements. I said, okay, maybe you need some of these. I don't know. We're going to find out. I can't see into your body, but what we'll do is we'll run the blood work. We run it. I said, you don't need to be on any of these things. I said, you need to be on like these 3 things. That's it. And what was interesting about this case was he was on a lot of anti-inflammatory type of products, a lot of different herbs that were fantastic herbs and nutrients, the best quality for pain and inflammation in his joints and his muscles. I said, and at the time we also ran a food test, a food sensitivity test. So I said, you know what? You don't need any of these anti-inflammatories. He goes, well, why not? I'm inflamed. I said, well, all you got to do is stop eating these foods that we identified, and your inflammation will go away, and you won't need all these things. He's like, oh my God, in fact, one of the interesting things was he tested positive on his food test. On the food test, we test for spices and we test for food additives, and at the top of his list was curcumin or turmeric, the spice turmeric. This guy's taken 3 different types of turmeric products prescribed by another doctor. I said, well, in theory it makes sense. Okay, you're going to take this turmeric and it's anti-inflammatory, but in your body it's inflammatory. It's like, oh my God, Then the other thing was, the other doctor had him using whey protein, whey protein shakes every morning. The guy had a severe dairy sensitivity. I said, well, that's the value in putting the money into doing the testing, opposed to just throwing money at a shotgun approach, individualized, right? Individualized medicine. And so that's the big differentiation. So that's how I differentiate myself, not only from conventional doctors, but also other people in my field, because their intentions are there. They're good intentions to get the person better, but if you're not looking past your nose, it's like you're fitting everyone into this one-dimensional model here, and so a natural doctor could be just doing the same thing as a conventional doctor, but just using herbs and nutrients opposed to drugs. There's really no, using the herbs and nutrients is better than using the drugs in the long run, but there's no real differentiation in terms of how you're getting this person better. You're really not. You're just masking.
So it seems like there's situations where people have scarcity mindset that drives them to buy lesser quality supplements, but buy in a wider variety because they don't stop and get an expert's opinion. Now they're trying to
shotgun.
And then they're creating problems that aren't even the ones they started out with, and then they're just making it harder for you to undo that sort of thing.
Yeah, and that was the stimulus for me to write this book. Exactly what you said. It's because I can reach a pretty good audience of people that come to see me and when I do talks and things like that. But this is on a wide scale. If I could get this book out to everyone, if every conventional doctor said, here, read Dr. Aieta's book and see what you think, I think we would minimize the amount of chronic illness that we have in this country by substantial amounts, but the drug companies wouldn't like that.
I was going to say, that's a good goal. I don't know how realistic it is, but it is realistic for someone to pick up the book because it's an easy read. It's not very easy. It's not 5,000 pages. It's very concise.
It's like 50 pages with a lot of just reference stuff, so it's not hard reading. I'll come out with an audio book to make it really easy.
Yeah, take away their excuses. And then this also keeps you, when you internalize a new patient, when you bring somebody onboard them for your process, you don't have to remember to say all the things, because when you're doing that repetitively, it's just better to have a handbook that they can reference on their own time. That's
exactly right. That was another reason for doing this. It's like, okay, I keep having to say the same thing over and over again. It's interesting because I have patients that I've been seeing for 10, 15, close to 20 years. And they may come back and see me once a year and we run our annual blood work. And I have some patients that were saying I'm saying the same thing over and over again. And and now it's like, okay, your blood work doesn't look that great. So, instead of going through the whole spiel again, read the book and you come back and when you're ready, So it's hard, people forget. It's easy to go back to that comfortable mindset of, what you were doing initially. So I'll have a patient, we'll go through and explain the whole carbohydrate thing. You need to scale back on this. I see him 6 months later, a year later. What are you eating for breakfast, lunch, and dinner? It's the same exact thing that they told me the day one that they came in to see me. Oh, I'm eating my big bowl of oatmeal. I'm eating, it's like, okay, well, didn't we talk about that? and that's why this looks like this. Oh yeah, I forgot. Well, I like it, so I gravitated back towards it. And I heard that it's good for your cholesterol to eat a lot of oatmeal. I said, we debunked that a long time ago, but I'll talk about it again. So it is that repetitive nature, and some people need to hear it over and over again, but when it's not sinking in, it's like, okay, I think now what I'm going to do with most of my patients is, your homework is every 6 months reread my book and then come in and see me. So reread it the night before, so you could probably bang it out in an hour. Come back and see me, and then make it a little easier. And it will stick, I think. I think it'll stick a little bit better when they're constantly being exposed. Because listen, I need to hear stuff over. A lot of times, I forget to practice what I preach. It's easy to fall off track. So you need someone keeping you accountable. But if you have this as a resource, at least you can say, I have this.